This week on WNIN Lawmakers, Indiana State Senator Vaneta Becker and Indiana State Representative Ryan Hatfield join us next. I'm John Gibson, and this is WNIN Lawmakers. A Department of Child Services oversight bill dramatically scaled back, syringe exchanges given a little extra time, and consensus reached on a smoking age increase. Indiana Public Broadcasting's Brandon Smith reports on the week at the State House.
Legislation to impose more oversight on DCS originally created a new committee that would investigate decision-making at the agency over every case in which a child who had contact with DCS later died or was seriously hurt. But now, lawmakers are instead seeking to resurrect a defunct legislative study committee to examine child welfare issues. State law eliminates Indiana's 9 syringe exchange programs July 1st, 2021. The Senate earlier this session killed a bill that would have extended the programs indefinitely. Now, in an effort to give those programs a bit more breathing room, legislators are pushing a 1-year extension, extending the programs until July of 2022. And House and Senate lawmakers unveiled the likely final version of a bill that raises the legal age to smoke and vape from 18 to 21. The measure doubles the fines for retailers who sell to those underage, but it leaves unchanged the current penalties for youths who are caught smoking, fines of up to $500. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
I'm joined now by Indiana State Senator Vaneta Becker, who represents portions of Vanderburgh and Warwick counties, and Indiana State Representative Ryan Hatfield, whose district includes portions of Vanderburgh County. I'd like to thank you both for coming in today. We certainly appreciate it.
Thank you.
As Brandon Smith just mentioned, consensus has been reached on the tobacco vaping bill that increases the legal age for smoking to 21. It includes some fines for retailers and fines for offenders. Just to see how both of you are feeling about this bill. Some folks I know were concerned about the fines, that they may be too high, at least on the offenders. We'll start with you, Representative Hatfield. How did you feel about the outcome of that particular bill?
I think the bill is in pretty good shape. I really commend all of the stakeholders coming together, including the tobacco companies, but the healthcare providers and smoke-free communities and others all came together and said, let's get this done. 1, we need to be in compliance with federal law, and 2, we know that we have had a spike, especially with e-cigarettes, amongst our youth in tobacco and nicotine use, and we also know that those have harmful effects disproportionately amongst our youth. And so this effort, I think, is in a pretty good place to raise the age from 18 to 21 and to make sure that we're keeping tobacco products out of the hands of our youth.
Any concern that those fines on offenders might be too much?
You know, part of the problem with taking them out was if you didn't have any provision civilly to punish, if you will, the offender, you didn't have any ability to take the pack of cigarettes that they were illegally possessing. And so perhaps the fines were too high, but we're trying to hit a balance, I think, of what do you do when a police officer or a store owner comes in encounter with a youth who has illegally possessed tobacco. If it's not illegally possessed, then you can't take it from them. And we wanted to make sure that we were keeping it out of those hands as often and as best we could, and that provision allows for us to take those cigarettes.
And Senator Becker, I'll let you weigh in on it. It was Senate Bill 1, as I understand. What are your thoughts about the bills? Did you have any concerns about those fines?
Well, I think those fines are just maximum, so they could be a lot less.
So there's some discretion there for the judge?
Yeah. Mm-hmm. So I think the bill's in pretty good shape. I was really kind of surprised that it passed the Senate with only four negative votes. The one concern I still have is about the flavored vaping products, and we really didn't do anything to address that issue, and I think that's something in the future we probably need to take a look at.
So those liquids, the vaping liquids, are not covered by this particular?
They're covered by it as far as age, but I think we probably should be checking out those flavors. We had a bill that came through public policy, but it had a lot of issues, so we just dropped it for this session, but I think they'll be back. But yeah, I mean, as far as the age and all that, they fall under the bill as well.
Yeah. Concerns about those flavors, is that the kind of thing that younger people are more likely
Yes,
to go for?
they're more likely to use flavored vaping products than if you didn't allow for flavored vaping products.
All right, well, let's move on to another bill here that's received quite a bit of attention, House Bill 1004. It addresses surprise medical billing. It passed the House unanimously, had a hearing in the Senate Health and Provider Services Committee this week and passed. Senator Becker, we'll turn it over to you. Now, you voted against the version coming out of committee. What were your concerns about that?
Well, because they had a huge amendment, probably a 30-page amendment that we didn't even get until the morning of the vote. So you don't even have an opportunity to hear from the people that support it, you'll hear from the people that support it because they've worked behind the scenes to get the amendment, but you don't hear from everybody. We had a 3-hour hearing, and it raises a lot of questions. A lot of the provisions that had been originally in it were good. They had been in surprise billing, gag clauses, all payers data claims system, lots of good things, but they added an amendment that would give Anthem, in my opinion, card to steal from hospitals and other healthcare providers. They would be the ones deciding. The issue is site of service and what constitutes a hospital charge versus a physician's charge. And Anthem wanted the ability, they would have the ability with no mediation to decide how those bills are paid. And for hospitals, especially if you're in a rural area where services are very difficult to get, those county hospitals will go under if this bill passes.
All right. Well, we'll turn it over to Representative Hatfield. We were talking about this issue a little bit before we went on, and I believe we even referred to it as a poison pill, no pun intended. What are your thoughts about that amendment?
So House Bill 1004, in my opinion, was in pretty good shape as it left the House. And in the Senate, it picked up some language that is troublesome. The senator and I have had early morning conversations all week about this bill, and the reality is the language that she's referring to about site of service will probably take down a lot of rural hospitals. But even locally in Evansville, you'll see hospitals like Deaconess where they have a specific breast cancer entrance and building for breast cancer patients to arrive at. This language would drive down the reimbursement rate from the insurance company. What we're trying to do this session is drive down healthcare costs for the end consumer, for the folks that are paying that at the end of the day, paying that bill, sitting out their kitchen table and trying to figure out how to pay for their healthcare costs. What this language will do is not do anything for the end consumer, but rather drive profits to the insurance industry. It's an insurance industry supported amendment, and it will drive down the reimbursement rate to the hospital, which will mean less money being paid back for services that the hospital's providing, meaning they can do less, and like the senator mentioned, will probably close a lot of rural hospitals, hurt hospitals like Deaconess and urban areas, and drive up profits for the insurance industry. In my opinion, the exact opposite of what we're trying to accomplish.
So, Senator Becker, do you feel that is this bill going to pass the Senate?
I don't think it'll pass without some changes to the bill, and the site of service is the big thing that people are concerned about. I met with Deaconess Hospital earlier this week. They're very concerned about their chemotherapy. The Children's Hospital, the Women's Hospital, they have a partnership with Riley Hospital. This would be very detrimental to the perinatal services that they provide. It would also be detrimental to the fact that Deaconess has this partnership with MD Anderson, which is a wonderful cancer institute in Texas, and this would be detrimental to that as well. And not just them. I've heard from Greene County Hospital, they are scared to death. I mean, they will not be able to stay open if this bill passes the way that it is. Now, I talked to my legislative assistant this morning because Senator Charbonneau, we share the same legislative assistant, she told me, she said, well, that bill won't pass the way that it is. So we're working on amendments trying to clean up that language. There's a lot of good things in that bill, so I really hated to vote no, but I could not do in good conscience vote for something just because the insurance industry supports it. And the other folks that it helps are self-insured funds, like big companies that employ over 500 people.
Right.
Because they are self-funded, they would potentially see some cuts, but the average Joe consumer out there that is on their own, if it's not a policy that their employer provides, would be hurt.
All right, well, we will keep our eye on that bill and see how it does in the Senate as we go into these final couple of weeks in the General Assembly. Let's move on to Senate Bill 98, which Senator Becker authored. It's now headed to the House Committee on Public Health, which Representative Hatfield serves. It would allow nurses who perform anesthesia, as I understand it, operate a little more independently. Perhaps, Senator Becker, you could refresh us on exactly what it would do, and I suppose you can make your pitch to Representative Hatfield here.
Well, it's too late because it didn't get a hearing in the House because the anesthesiologists were opposed to it, and we could not work out an agreement with them. I think they just didn't want to work out an agreement. This bill was very important for small rural hospitals in particular. Yeah. It would have allowed a podiatrist to work with an anesthetist, and our hospitals use an anesthetist every single day, but we could not get the anesthesiologist, and you will find in these rural areas they can't even hire an anesthesiologist. Right. They're too expensive. So we'll have to come back next year and work on it again.
So it looks to be dead for this session?
It's dead for this session.
All right. Did you have a chance to look at it, Representative Hatfield, and what are your thoughts on it?
What it's aimed at doing that I'm supportive of and that I think a lot of us are trying to accomplish is lowering healthcare costs for moms and dads out there who are trying to pay these bills. And there's a lot of money in the healthcare industry. There's a lot of hands out in the healthcare industry, whether you've got pharmacists or hospitals or insurance companies or pharmacy benefit managers or drug manufacturers. Everybody is trying to take their share. The problem with everybody taking their share amongst that group is it leaves out the end consumer, the folks that the senator and I represent and the folks that we're there trying to go to bat for. And so the bill's aimed at lowering healthcare costs. I support that initiative, and I'm hopeful that not only this year and the time that we have left, but in years to come, we'll continue to drive down healthcare costs for the folks paying the bill at the end of the day, not just simply trading money amongst the industries, but making sure that we drive down healthcare costs.
So Senator Becker, did this seem to be the anesthesiologists trying to essentially hold on to their share?
Yes, that's basically it. What we find in these healthcare bills, a lot of times, most of the time, it's a turf battle. The anesthesiologist didn't want to give up anything to the anesthetist. Anesthetist, what this bill would have done is would have reduced costs and provided more access to inexpensive health care. And it's unfortunate that we could not work out agreement with the anesthesiologist, and I couldn't get the healthcare chair to consider it otherwise. So.
Okay, well, we will, I suppose, see what happens next year on that one. Let's move on to House Bill 1326, which passed the House unanimously, passed committee. Senator Becker, you're signed on as a sponsor of the bill in the Senate. It's about community mental health centers. Well, we're continuing on a health theme here. Exactly what would this bill do?
Quite honestly, I can't remember.
Well, perhaps, are you more familiar with it?
Well, it's been through the House, and I'm not sure exactly where it is in the Senate. And the senator carries a lot of health care legislation, but it is aimed at funding mental health centers around the state. I don't believe that it called for opening new ones, but it had a funding mechanism to allow for a new stream of, I believe, grant funding for mental health services.
I think that's right. I wasn't the first author on that bill.
That's right.
So I really wasn't as familiar with it. But I do recall, and going back to 1004, the community mental health centers testified against that provision on site of service too, because they are very concerned. They just operate on a shoestring budget as it is. So, but this would have allowed for more grants for community mental health centers on 1326.
All right, well, while we're in the realm of health, and I promise this will be the last health question, what is the role, if any, of state government in a potential pandemic like we're seeing with the coronavirus? Representative Hatfield, have there been any discussions or concerns raised in the General Assembly about this?
It's funny you should ask. By the time your viewers see this program, I would anticipate that House Democrats will have an effort to more fully fund the Department of Health to make sure that they have all the resources they need to deal with the coronavirus. Today, Sunday, we've learned that there's the first outbreak in the United States of testing positive, and while the regular flu impacts more people on a daily basis, what's scary about this particular string of flu is that we don't know how it is transmitted, and it seems to be transmitted quite rapidly. And so containing that spread of coronavirus is important, not only to make sure that people stay healthy, but the economic impact here and around the world will be devastating if we don't quickly get a handle on it. And so I'm pleased that the federal government seems to be reacting rather quickly. I'm hopeful that other states will make sure that they're providing the resources. But here in Indiana, I've not yet seen a real effort at making sure our health department is prepared, and I hope that I will continue. I hope that that effort will take place rather soon.
Senator Becker, what are your thoughts about the state preparing
actually,
for this possibility?
One of the things we didn't touch on was the syringe bill.
Right.
But I will say that I just read or heard on a TV spot that Dr. Box, who is the CEO, or she's the commissioner for the State Board of Health, and she says we are well prepared for the coronavirus. And really what they're encouraging people, if you haven't had a flu shot, to go ahead and get the regular flu shot, because it won't immune you against the coronavirus, but it's more likely you'll get the regular flu than you will get that.
Right.
And I think the federally concern I have is that a lot of these programs have been cut at the federal level for research and development.
All right. Well, we will see how that shakes out. You did mention the bill regarding syringes and such. So I guess we'll touch on another health issue here. Exactly what happened there with that bill, and what will it do?
It was originally defeated on the floor because it extended the syringe program indefinitely.
Right.
I'm carrying a bill, House Bill 1182, which extends the syringe program by 1 year, and it also updates HIV language in the code to more person-centered than it used to be, and it also calls for testing if a healthcare provider gets a stick in caring for a patient. It's a good bill. We had lots of positive testimony. It extends it for a year, but it also provides wraparound services for someone who actually goes through the syringe program, and it also provides a report back annually to the legislature.
And of course, there has been some controversy about syringe bills and whether it might contribute to drug abuse. Representative Hatfield, what are your thoughts about this bill? Are you glad to see it extended at least another year?
I am. I'm disappointed, and this is no reflection of the senator, because the senator has offered a bill, and I believe it'll become law in order to protect this program. But disappointed that we were not more prepared to deal with this issue more fully this session. We really should have been, and it's unfortunate that we're not. But given the position that we're in and the lack of conversation about it, the senator's bill is the most important effort we can undertake right now to help save that program. The program's important for so many reasons, but first and foremost, the ability to stop the spread of diseases and the ability to offer treatment when somebody comes in to get a new needle. And so I am supportive. I voted in opposition to the original bill in 2017 that expanded the syringe program to more areas of the state, but I voted against it because I thought it added a layer of regulation locally that was unneeded, and thought that we should be offering it more readily without that layer of regulation. But I'm supportive of the senator's efforts to extend it a year. I think it's important that we do that so that we can have a fuller conversation about where to head in the years to come.
Yeah, Dr. Box testified that actually in Scott County they have saved $2 million a year as a result of the syringe program. And we have found statewide people were concerned about syringes, but they forget that it's not just HIV, it's also hepatitis A and C. And if they're in a syringe program, one of the physicians testified that people are 5 times more likely to get treatment. So that's very positive, and that 80% of all the needles that are given out are returned throughout the state.
All right, well, let's move on to a Senate Bill 334 that deals with a variety of voting issues. It moved over from the House. Several amendments were offered there. Representative Hatfield, I believe you voted in favor of those amendments. Apparently, many of those were squashed. Can you tell us what you wanted to see in this bill that ultimately wasn't there?
That's right. Senate Bill 334 deals with election security, and while Indiana has had generally success in protecting our elections, we have seen irregularities in certain parts of the state, although not determinative. They certainly have been there, and we want to make sure that we're protecting our elections and that folks have access to the ballot, access to the voting centers, and that they can show up and vote, and that they can feel secure that their vote is being registered as they intended it to be, and that we come out with the appropriate vote total and thus the appropriate office holder and the appropriate winner. What we know is that there are foreign actors all over the world trying to interfere in United States elections, both at the national level and at the state level, and we need to do more to protect that. The Secretary of State's office at one point said that we needed upwards of $50 million to protect our elections. House Democrats yesterday on the floor offered amendments to fulfill that funding request by the Secretary of State in order to protect our elections, and I was disappointed that House Republicans voted those amendments down. We felt very strongly that it was important that we do this before what many believe to be the most important election of our lifetime in 2020, and that we get it right. And we were prepared to fully fund election security, including cybersecurity, for our elections and for our voting booth machines, and thought that was important, and were disappointed that those weren't accepted.
Let's get Senator Becker in on the discussion. I understand one of the concerns about the voter rolls is the concern that eligible voters might be purged. What are your thoughts about this bill? Have you seen it? Do you agree with the gist of it?
I didn't. Of course, being in the House, I wasn't privy to the amendments, but it's not a budget year, so my guess is that's one reason why $50 million probably would not be affordable in a year without a budget. But I think we need to continue to work to make our elections safer. I would agree with that. I think that a lot of people would like to go back to paper ballots, but I don't think that's the answer. I think we just want to make sure that our electronic machines are correct. And I know that there is a time frame for them to update that. I do recall the discussion on that in Senate Bill 334, but quite honestly, it's been about 4 weeks.
Right.
And a few other bills have passed since then.
Do you share any of those concerns about possibly eligible voters getting purged?
I don't think that's really a concern, because I got a notice at home, and if it doesn't go back to the Secretary of State's office, if you don't return it, or if you have an issue. But in most cases, I think the purging, we need to purge, because a lot of times people have died, and we don't want to vote people that are no longer living, and that has happened before.
Certainly in Illinois, as I understand it, yes.
So we want to purge, but we want to do it so that people that just haven't voted for the last election are not purged inadvertently.
All right. We have just a couple of moments left. An opportunity here. What are some, as we come down the home stretch, just less than 2 weeks to go now in the General Assembly session. Representative Hatfield, any last minute bills or things you're hoping to see here in the closing days?
You know, I'm currently working on a couple of bills that are still alive that have my name on it. One has to do with water notification of dangerous spills into our waterways. Another has to do with driving privileges and making sure that people can get a license and get themselves to work and get their kids to daycare. But the effort that I'm working on every single day from now until the end of session has to do with pharmacy benefit managers. These are the middlemen between drug manufacturers and employers who promise to take pharmacy benefits and lower the cost of drugs for the end consumer. And many studies have shown here in Indiana and around the Midwest, these pharmacy benefit managers come into the middle of that process, take millions of dollars out of the system for themselves, and leave the end consumer with a higher cost at the pharmacy. And so we have a bill that's moving that has to do with pharmacy benefit managers, and I'm hopeful that we'll pass something that provides transparency around this industry and drives down the cost of drugs.
Senator Becker, what do you hope to see in the last week and a half?
Well, I would agree with him on the pharmacy benefit managers. I mean, quite honestly, we had a study committee that we both served on this summer, and I suggested that we just eliminate them altogether. I mean, they are in it to make money, and they're the only ones that benefit. These reductions and rebates are not passed on to the individual. So, but I just hope that we have some education bills that have actually passed, and we have decoupled the test scores with teacher evaluation.
All right.
I think that's very important, and we've also put on the iLearn, the results. We've protected schools as well as teachers and evaluations from the results of the iLearn. Quite honestly, I just wish we would eliminate it. And the Education Committee needs to stop. Every year they pass more bills that just confuse people and change the rules, and it just really disrupts the education system.
All right, we'll have to leave it there. I'd like to thank both of you for joining us. Senator Becker, Representative Hatfield, thank you so much. Next week, our scheduled guests are Indiana State Representatives Ron Bacon and Matt Hostetler. Thank you for joining us for WNIN Lawmakers.